Well, good afternoon, everyone, and welcome to this one of my most favorite events. And if you notice, I might be kind of turning my, focusing my eyes in a different way because I still, after all this time, I still haven't memorized my script. So, again, my name is Lynn Duran, and I'm the Assistant Dean of Student Affairs at the College of Public Health. And thank you so much for joining the virtual MPH Applied Practice Conference Student Highlight Event. Again, one of my favorites. We're so excited to have you all here with us today, including some of your current students, faculty, preceptors, and prospective students. We would like to take a moment to respectfully acknowledge that the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the Atam and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. As you may know, our Master of Public Health students from each of our campuses conduct applied practice experience in communities around the world. The applied practice experience serves as an integral part of the MPH degree curriculum in which our students utilize their academic knowledge from the classroom in real-world practical situations among professionals in the public health workforce. We are so profoundly grateful for the collaborations between our students, faculty, and agency preceptors, and are very proud of the contributions our MPH students have made to the field of public health. The virtual applied practice experience conference is our opportunity to showcase the breadth and depth of health work that our MPH students have done with local, national, and global communities. Coming up next, you'll hear from some of our MPH presenters and learn more about their amazing experiences. After our student panel, we will provide some additional details about the conference and how to view our fantastic student presentations. Thanks again, and I'm going to turn it over to Kim.
Hello, everyone. Again, welcome. Thank you, Lynn, for starting us off. My name is Kim Barnes, and I'm the Director of Student Affairs for our Phoenix campus, although I do work across campus with many of our MPH students and my fellow MPH coordinators. We're very happy to welcome you all today. We have some great panelists with us. We have Shannon, Caroline, and Romina. And our panelists today are representing the Tucson and online campuses and the health behavior and health promotion and global health concentration. So we're very excited to learn more about their applied experiences today. So this is how sort of we'll function today. It's meant to be a chat. So if you have questions, feel free to raise your hand, feel free to unmute, put your question in the chat. Any which way you'd like to communicate. I do have a set of prepared questions for our panelists, so we'll start with those. If one of those prompts a question from you, please, again, raise your hand, use the chat. We'll certainly have time at the end of today's session for open questions as well. And then, as Lynn mentioned, Danielle and Vanessa will give us some additional information about where you can view other presentations at the end of today's conference. So I'd love to start us off by having our panelists introduce themselves and a little bit about their applied practice experience. They're kind of going to give you the elevator pitch about what they did, and that's your hook to make sure you watch their presentations after today's session as well. So I'm going to ask Shannon if you would get us started, please.
Sure. My name is Shannon Alexander, and I am in the online program for health behavior, health promotion. My project was integrating birth doula training into an existing community health and wellness program at Pima JTED. So the students there were all seniors. They're in their second year of the program at this point. And by the end of their year, in their senior year, they are eligible once they meet their hours to become community health workers. They get a mental health certificate as well. And then with the addition of the birth doula program, because it was approved by the state, that was part of my project, once they turn 18 and attend 3 births that qualify, they can become licensed by the state of Arizona and start taking access patients. So big win for kind of those social disparities and providing care to all levels of people giving birth and newly postpartum.
Thank you, Shannon. Caroline, could you introduce us to your project, please, and yourself?
Hello, my name is Calixte. I'm doing my Master's of Public Health with the concentration of global health at the University of Arizona Online. I completed my APE with the Community Outreach and Engagement Department at Mayo Clinic. During my internship, I worked on 2 major projects. The first one involved the Course 25 report, where I summarized litigation findings from tobacco cessation and sun safety programs serving Native and Hispanic communities in Arizona. Then the second project focused on the cancer causation series, where I translated technical evaluation data into reports that community partners could easily understand.
Thank you, Caroline. Appreciate that. And last but certainly not least, Romina.
Hello, everyone. I'm glad to be here today. My name is Romina. I recently completed my MPH in health behavior and health promotion. I did my internship at Arizona Department of Health Services under a program called Overdose Data to Action as an evaluation intern. So a little bit about my project. Many of you may be familiar with naloxone or Narcan, a medication that reverses opioid overdose. So in Arizona, there is a new harm reduction strategy for distributing naloxone. It's called naloxone vending machine. So these vending machines provide free, anonymous, 24/7 access to naloxone. For now, there are 7 of those across Arizona. So my role was to assess how effective are these vending machines in providing access and educational materials to people who use drugs in Arizona. And as part of data collection, I interviewed staff from organizations that operate these vending machines. I also visited each site that provide these vending machines to audit those machines in different parts like Flagstaff, Cottonwood, different areas in Phoenix. And also a big part of this program is a community advisory board made of people with lived experience with substance use. They were also engaged in this process. They acted as co-evaluator, not just participant. And at the end, I integrated all my findings. I also included the voice of the CAB members, and I produced a final evaluation report. And I made recommendations at 3 different levels to ADHS, to organizations, to community members on how to improve access, privacy, and expanding these vending machines across Arizona.
Thank you so much. So what I love about this conference every year and just about our MPH program in general is the varied experiences that our students will have, even if they're in the same concentration. It's just amazing. We have cancer prevention, we have harm reduction, and we have education, community health worker training. I mean, those are fairly different experiences, but I think that sort of shows the breadth of public health as well. So something I'm always curious about, and I think folks in our audience are often curious about, and certainly our first year students, is how did you all find and secure your APE opportunity? So were you networked in? Did you apply to it? We're always sort of curious how that happened for you. And Romina, if you could start us, that would be great.
Sure. So I started my MPH program in epidemiology, and then after a year, I switched to health behavior and health promotion once I realized my career goals aligns better with this new concentration. So after I switched, I knew I want an internship that involves more community engagement rather than be on my computer the entire time. I was looking for qualitative work. And then I found my internship on LinkedIn. In fact, it was the first position I ever applied to on LinkedIn. And I had no connections at ADHS. I was new to qualitative research work, but I really showed my interest that I'm passionate about this work. And that's my advice to other students. If you're really interested in the position, don't be afraid of things like I don't have connections, I'm new into this field. Just apply, you never know.
That's great. Thank you. Yeah, I see an ADHS person in the room. I won't call them out right now, but I do see them. So I was wondering if there was a connection there. He's laughing now because he knows I'm talking about him. So I do. I appreciate that, Romina. And that's great news about LinkedIn. I think that's something to encourage for us to make sure we encourage students. LinkedIn is not just a place for graduates, it's a place for current students. And so that's really great to hear. And congrats on getting the first one. That's always a win, right? Caroline, could you tell us how you got your experience at Mayo Clinic?
I found my internship by searching for different opportunities, but Mayo Clinic matched my interest in community health and health education and food evaluation. I want to experience that would allow me to apply while learning my MPH courses while contributing to meaningful public health work. Mayo Clinic stood out to me because of its commitment to reducing cancer disparities, because the internship offered planning to work remotely while traveling to experience public health professionally.
That's great. So did you you found the internship online and then did you have to apply to it? Was it an application process?
Yes, and then afterwards, I did a interview with them.
Oh, excellent. That's good to know. I know we have advertised Mayo Clinic opportunities in the past, and so it's really great to hear when our students secure those. It's helpful to know that that connection is good. So that's great. And then Shannon, tell us a little bit about how you found and secured your opportunity.
That's a little non-traditional. I
No
complimented
such
someone
thing.
on their
It's the
boots.
rainbow. Yes.
I complimented somebody on their boots. I was at an event and somebody turned around and said, "Hey, could you take a picture of my girlfriends and I?" And sure. So I take the picture and said, "By the way, I just have to tell you, I love your boots." She goes, "Oh, these are so much better than my working shoes." I said, "Oh, I could do 24-hour shift in my working shoes." And so we get to talking about working shoes. Turns out she's a former nurse. I'm a birth doula. She says, "We're trying to expand our community health and wellness program. Would you be interested in maybe talking to some people about adding a birth doula curriculum?" And I'm like, "I happen to have a master's applied project that I need to do starting in a couple months. Yes, let's talk." So networking, yes, but always compliment a lady on her shoes.
Yes, the power of the boots. I just read a quote the other day, which is that it was something along the lines of when you have something nice to say about somebody that doesn't belong to you anymore, you must give it to them, right? Like you have to share that with the world. So excellent way of making that connection. But the importance of connecting, right? We connect, we network in different ways. Sometimes it's in an informal way, sometimes it's more formal, but the power of conversation and leading us down the roads that take us amazing places, right? So that's excellent. Thank you all for sharing that. So full 180 from that question. I like to jump right in. We'll get our hands dirty. Is what did you find most challenging about your experience? I like to start with the challenges because then I think we kind of can build up to the successes. But what did you find most challenging about your applied practice experience? Shannon, will you start us?
I guess I'm the only one not muted. At teenagers. 17 and 18-year-old teenagers with the attention span of the length of a Reels, TikTok videos. Just engagement. Engagement was a challenge. Creating the content, kind of came naturally because I actually had so much free reign to not only just do your standard birth doula curriculum. These students have gotten bioethics, they've got social determinants of health, they've got perinatal mental health, they've gotten so many added modules, they've got Dr. Sears' lean expectations about pregnancy, nutrition, and wellness. So they've gotten a lot more than a standard doula training, but making that content engaging Because at first they like didn't want to do role plays, but towards the end they're like, let's do all the fun scenarios, because when I'm the birthing person, I get a little crazy. I have a lot of fun with it. So yeah, but so
Yeah.
it challenges and bonuses.
That's great. That's great. I have also been a birthing person for a scenario, and it's a little weird, but also fun. So, yeah, I think that engaging teenagers, it is different than engaging other members of the community, right? They want to be there, but you have to keep their attention, and that is, as we know, can be challenging. So yes, your presentation talked a lot about that, and I was really surprised, not surprised, but excited to see how robust your curriculum was. And I mean, I hope that they understand what an amazing experience that they've been able to be a part of. It's really great. Caroline, could you share some challenges that you experienced with your APE?
One of my primary challenges that I experienced in my internship was translating technical evaluation findings into community reports while maintaining scientific accuracy. I addressed this challenge by carefully reviewing evaluation data, focusing on key findings and incorporating feedbacks from my preceptor and team to improve clarity and readability. Another challenge was balancing multiple projects across the fall and spring semester while working remotely, but staying organized, attending the weekly meetings, and consistent communication with my team manage those deadlines and start my skills.
That's great. And in your presentation, you talk a lot about how some of those challenges with doing the translating or community or time management were real important for you, as they kind of really helped you grow into learning those kind of skills that maybe they're not directly connected to the MPH curriculum, right? But you need them to be able to do the work. And so I like how you tied that in your presentation, that these were real life challenges to that professional experience, but that's where you grew a lot and able to sort of expand. And it sounds like you had a really supportive team, which I think was
Yes.
great to hear. Yeah, that's excellent. Romina, some of your challenges for us.
So one of my first challenges was during the data collection part. My first interview was supposed to be one by one, and in the last minute, it turned to be a group interview. So I was a little bit nervous because I was not expecting that. I had challenges with time managing. And the other one was during presenting my findings to the community advisory board, because it was my first time presenting a piece of information outside the academia. But that was a good lesson that I learned.
Yeah, that's great. And you also talked about how those challenges were really some of the places you grew the most. And so I think it's important for folks to understand, especially any current students in the room, prospective students, or those who are listening to the recording later, that those challenges you might face, or the things that you're maybe a little afraid of approaching your APE, are also really the best opportunities that you'll be able to grow into, whether that's your skills or, the MPH skills, certainly, but also those communication skills, navigating quick changes, which leads me into my next question, which is, were there opportunities in your project, and this might be a yes or no answer, where you really had to pivot? So you had a plan and you were headed in that direction with your plan, and something derailed you a little bit and you had to kind of resituate, retool. Romina, you talked a little bit about that. You thought we're going to have one person, and you were mentally prepared for one person, and all of a sudden managing a team interview is a vastly different type of engagement. Did you have other opportunities where you had to pivot?
I don't think so, but yeah, that was one of the example, I think.
Yeah. Yeah. That's great. I'm glad you didn't have other opportunities. Usually a pivot means something went wrong somewhere, and it doesn't feel great. So I'm glad to hear that. Caroline or Shannon, did you have opportunities where you had to pivot?
I don't really think so. Just sometimes day to day in classroom instruction, you can kind of see what's working and what's not. And, just because we've created this amazing content, it's finals week for the kids, and they're so tapped out, and they just want to, like, can we just like play birth bingo? or we would do that right before Christmas and at the end of the year. But sometimes they're less engaged, and kind of sometimes, or we get through the content really fast and it's like, oh gosh, I thought that was going to take an hour and it took 40 minutes. Okay, it's not yet snack time, so let's find a video to watch. So
Yeah.
and I think Miss Wall's on here, my co-teacher, and our technology issues were always fun. So yeah, getting things to load and play was always interesting for us. So
yeah, those day-to-day pivots. I mean, again, I'm glad to hear that there were no major pivots, but those day-to-day shifts and changes do present challenges and do make it so you have to kind of be on your toes for your experience, because you're building towards something, towards that end, but you're also delivering a curriculum, right? And so you have to make sure to manage and balance that. Caroline, did you have any opportunities or needs to pivot?
I would say I had any major one, but one minor one that sticks out is transitioning from fall semester to spring semester. Even though it was remotely, I still had to make sure I had time to do all my work. And my help was being able to do our own. Like we had to block out the calendars and then we were able to meet every week. So that really helped me like keep steady during the both semesters.
Yeah, that's a really important point you make about balancing. So that's often something we hear from students is, how am I going to balance my APE with coursework and the chaos that is my life, and whatever that looks like for you. And yes, calendaring and blocking out that time. But that's a really important consideration students need to make as they're exploring their APE opportunities and making those adjustments, is where does all of that work and time fit in? Especially if you're remote and you're having to really manage yourself in that respect. So yeah, good job working on that pivot too. Okay, my next question. And then I'm going to take a breath and I'm going to open it up to the audience too. But can you talk about some ways where your experience really allowed you to network, or how you were able to collaborate in your experience? All three of you talked about collaboration in your presentations. So I'm curious to hear for us today, where you found some really good networking or collaboration opportunities, or over which work did you see that happen the most? Caroline, do you want to start us today?
Yes. For me, during the spring semester, we had to collab with the other interns and preceptors from Florida and the Midwest. So we were able to see how their experiences went. And then we had to collab to one big project, which was the cancer conversation series. And then we'll communicate through Teams to make sure all our section went smoothly. And then at the end, we had a big presentation with all our parts in it.
Yeah, that's really great. I think oftentimes, even Maureen, we think of the APE as these individual students doing individual projects. But if you've applied to an experience, often there may be other interns that you're going to work with and collaborate with. And that's not something I really have thought much about. I was thinking more collaboration on the, like, with your preceptor or with groups or community advisory boards, but collaborating with other interns is another layer that we forget about when we're thinking about that whole APE experience. It's certainly not for all students, but when it happens, that is, especially you're across the country, right? You're collaborating with people who aren't here, and that adds another layer of complexity. So yes, thank you for highlighting that. I hadn't given that much thought, so thanks for that. Romina, could you tell us a little bit about some of the collaborations or networking opportunities you experienced?
Sure. So during my time at ADHS, in our meetings, I had opportunities to connect with professionals, and one of them turned out to be MESCOF alumni. And so we ended up meeting on campus. She could help me to get connected with people in my similar situation. For example, that during that time, I was looking for public health positions that sponsor H-1B visa, and I was surprised that person knew someone in our college that was on the same shoe like me and done the work I wanted to do. So at that moment, I realized how great connection and having connection and networking is.
Yeah, absolutely. Not just for the internship, but also for that next career step and the relationships you're going to make and build. Absolutely. Shannon, could you share? I mean, you worked with the state, so I know some heavy collaboration must have been happening to make that happen. Can you talk a little bit about that?
Yeah. I think the collaboration happened across multiple levels. I mean, working with my co-teacher, kind of planning out what are you guys covering in the community health worker program right now, and how can I best align the birth doula to what's happening on the days when I'm not there, to working with my preceptor who had had a previous experience getting the community health worker approved by the state. I'm actually on the Arizona Department of Health community doula board. So I had to recuse myself from that vote when we presented, but working with my preceptor, we were able to compile all of the hours and then present it. And it was unanimously approved. So working at that state level was awesome. And now that the students outside of the APE are moving on to do their clinicals, working with hospital staff and using existing modules that Pima JTED has in place with the hospital system for their other programs, we were able to get our doulas who have already turned 18 badged so they can come in and do their clinical experiences. And even today we were discussing working with fourth trimester out of the Phoenix area.
Yeah.
And what that collaboration could look like. So, and we've talked with Banner Hospital as well to get those clinical hours in and those births in for those students. So it's still kind of ongoing and unrolling. And then as more students turn 18, we'll be able to kind of fit them in according to their schedules. And so it's kind of very, very multi-level.
Yeah, fourth trimester is an amazing conference and organization. I do love them. Did you face any challenges, or are you facing any challenges with how young your folks are? Because they're just coming out of high school, they're just turning 18. Was that a barrier at all?
A lot of actually student nurses coming out of, say, PCC are kind of in the same boat because they're 18, 19, 20, so they're very
Yeah.
young as well. Um, it's not so much that, it's their own self-confidence. And so letting them know, like, a normal birth doula training is a 3-day weekend. They've gotten from August to May of education, for multiple hours a week. So they are well versed in many more areas. And so really kind of talking through, and we do a lot of role play. We do a lot of, you're going to walk in the room and tell me your 30-second elevator pitch, introduce yourself, say who you are, why you're there, how you can help them. So it's a lot of skills building, confidence building, public speaking. They all have to give oral reports occasionally. So their skills are way beyond what most people get in a normal training. So just letting them have confidence in that. Yeah.
That's excellent. That's excellent to hear. I'm so glad that it hasn't presented a barrier on the hospital
Mhm.
front, that it's more that self barrier,
Yeah.
confidence. That's great to hear. So Romina, did you have anything you wanted to add about any challenges or networking or collaborations or pivoting? I know you shared a little bit already. Is there anything you wanted to add? No?
Nothing for now. No.
Okay, that's great. I would love to take a pause for my questions. I certainly have more, and see if there's any questions in the room that folks have. Okay, well, we'll just keep asking. I have lots of questions I would love to ask. So next, I'd be curious to know if you can kind of briefly explain or connect what were some of the things you learned in your MPH curriculum that you felt you used the most during your applied experience, that gave you kind of the most opportunity to practice that knowledge, put it into play. Is there a class or two that stood out for you, and how it helped you with your APE? Caroline.
I think there was a specific course that helped me, but I think like all of them together help collab directly to my internship, like program evaluation and biostatistic, for me to understand the evaluation data, and health communication taught me how to present information clearly. And my global health and community health courses also emphasize health equality, which reflected throughout the projects I worked on.
Yeah, so you really span the gap, right? From the data
Yeah.
all the way through the health behavior side of things. That's great. I'm glad to hear it was really robust for you. Romina, what about you?
So I think the MPH coursework helped me to feel more prepared for my internship. One of my favorite elective courses is qualitative research method. In that course, I've learned about different types of interviews in qualitative work. It made me more prepared what to expect, how to navigate a conversation, or how to know my positionality as a researcher. And one interesting thing that I learned in that class is that as a qualitative researcher, we can use all of our senses, like what we hear, what we smell, what we see when we want to take observation notes. And that knowing that detail helped me a lot in my internship when I was auditing those vending machines.
Mhm.
It helped me with my notes a lot to take more detailed notes.
Yeah. So for those who haven't had a chance to watch Romina's presentation yet, part of it was observing the naloxone vending machines and sort of looking at their privacy and whether or not there was instructions or accessibility. So it's really great to hear that class really helped prepare you for something. I think many of us don't think about that observation data and how you're observing a static box, right? A vending machine, but with so many important variables to how people use it, how it's accessed, is it available, etc. Something you said in your presentation that I really liked, and I think it was that someone said it perhaps, is that making something available doesn't mean that it's going to be used, right? That making something exist doesn't solve the public health problem around that, and sort of how you contextualize that and the supports that you put in place really are important and valuable. And so you did a really great job in your presentation about talking about that observation of something, again, that would seem kind of dry, and it really wasn't. What you had to share about it was really important. So that's just a little tidbit. Make sure you watch her presentation. Shannon, what about you? MPH curriculum tie-ins.
Ooh, lots. A lot of the coursework, second year, is on public health program planning, management from stakeholder to evaluation. The evaluator piece is really interesting to me. But just a lot of planning each week. We're coming up with new curriculum, and so that was a lot of what the degree helped me with, along with just working with interprofessional teams and ethics. There were a lot of times where I'd be doing my reading for school during the week, and I'm like, ooh, I need to tell my students that. So those little nuggets in the reading that would come up, and I think it was Dr. Baylor Thomas. We were reading Anne Fetterman's The Spirit Catches You and You Fall Down. It was like a little side book club that she had us do in small teams. And I had owned the book for years and had never read it. And finally I was reading it, and I'm like, this marries perfectly with the cross-cultural experience in birth that my students might be a part of. So they were all got to choose a country, and they had to research birth culture in that country and then report back, and did great presentations for us. And then we brought it back home into the United States, and we talked about our own multiculturalism and different ethnicities. And they worked in pairs to kind of deep dive onto what you might expect with working with certain types of families, and what are our limitations, not just with language but with cultural beliefs. And so that book was really instrumental in helping kind of drive home some of those concepts. So yeah.
Yeah, who knew your students did not know they were going to get some master's level content in high school, did they? They
I
weren't
got a
prepared
lot
for
of
that.
it.
Yeah, that's great. And I also think something you said just highlights the importance of other engagement, which is that some of this came from a book club you opted into, not something you were required to do. And I think that that's important to showcase to MPH students, is that sometimes the things that are going to bring lots of value to your experience as a student are maybe not things that you're told you have to do, but opportunities presented to you. So I think that that's an important piece as well. Okay, so my next question is, is there anything, and this again, yes or no, maybe, that you would have done differently? So hindsight 2020, is there anything you would have done differently through your project? Something you think maybe would have improved it, improved your experience of the project, improved the actual outcome of the project? Is there anything you would have done differently? Caroline.
One thing that I would have done differently is if I had more opportunities to go in person, because they did have events during the week and then there's some on the weekend, but I was usually busy. So if something else different is be able to attend those events out in Phoenix, because I live in Tucson. So they were usually out in
Yeah.
Phoenix. Yeah.
Yeah, that's the trade-off, right? So it's great that you got to do your experience remote with such a great organization that isn't in Tucson. The downside is some of those other experiential pieces are physically in the Mayo campus, right?
Yeah.
Did you feel like you found other ways to connect with folks remotely,
Yes.
like via Zoom or Teams?
Yes. Some of the events they did do it through Zoom, and then I attended those ones.
Oh, that's great. That's great to hear. So yeah, I think that's an important piece, right? That's an experiential component. It didn't necessarily impact the outcome of your project. Still did great work and looked at, for those who haven't seen Caroline's presentation, very robust in terms of the number of cancer-related issues she was looking at, tobacco cessation, different kinds of cancer. So a lot of different reports happening that she was juggling. And so to know that that experiential piece would have improved it for you, I think that's an important lesson there. Thank you. Romina, what about you? Would you have done anything differently?
Maybe engaging better with community advisory board. So for the first time that I presented my information, I felt like that I wasn't on the right path. So if I could go back, I would change that presentation. So I presented many times, but for the first time that I presented, I was not completely ready, but I feel like that I wish I knew more about their background, their names, and yeah.
Yeah, you mentioned that in your presentation, that the presentation you would deliver to them is not the same as the academic presentation that you would give. And so I think that's a really important highlight too. And when most of our APE students are presenting back to their organizations, but a community advisory board, while organizationally related, is generally different. It's made up of folks from the community. And so I think that was a lesson you highlighted, that you would have sort of tailored that a little bit had you known, again, more about them or their experiences. That's a really good point. Shannon, what about you? Anything you would have done differently?
I think my advice would be more for people starting out their APEs.
Mhm.
That hour log that you get in Excel, really stay on top of it week to week, minute to minute. Anytime you're doing anything for your APE, track those hours. I was pretty good about that. But also, if you have a work product deliverable, stay on top of organizing that as well, because I'm working on now not just the curriculum, but the training manual and compiling everything together, whether it's, the PowerPoints to the videos that we use, to the handouts that we gave, to the scenario-based stuff. Compiling that all now is kind of presenting a little bit of a challenge. So I'm really trying to get on top of that. So if there are specific timely deliverables, stay on top of it.
Yeah,
That would
I
be
see Dr.
my
Gerard nodding.
advice. Yeah.
I see her nod. Yeah, and I think the lesson there in some ways is that many of our students are doing, including yourself, are doing projects that might not, right? You might not be the person to manage that in perpetuity, right? You're designing a manual or something that you're handing off, and is it robust enough that someone could deliver it in without you there? or without your additional feedback. And I think that can be very tricky. And that comes into play whether it's curriculum, evaluation plans, implementation plans. Is it robust enough that the organization now can take that and move it forward or do it again, right? I think that's really a valuable piece of information. Okay. So some of the next questions, again, please, if the audience has questions, I would love to hear from you. You can raise your hand. You can use the chat, whatever you would like. So this is sort of the thinking to the future. And I know we've heard a little bit about, like Romina, you talked about that connection for that next career step. But how do you think for you, your AP is going to help you in this next phase of your journey on your career path? Where do you see that helping you? Or is it not? And if your preceptor's in the room, feel free not to answer that question, if that makes sense. But can you see the ways that might be able to help you on your career path? Romina.
Well, yes, in this internship, I learned really valuable skills in qualitative research. It really helped with my communication skills, how to communicate with different audience. And so these are the real skills that I can carry with myself in every job opportunity. So my background is in fitness and wellness, and I plan to pursue a career in community-based fitness and wellness programming, and all these skills that I've learned so far will definitely help me to apply on my future career. I think you're,
I'm muted. I'm off over here chit-chatting. So I was going to say, what I was saying is that I like how you tied it to skills because, right, you just said your career is probably not in naloxone prevention. It's probably not in harm reduction, but the skills that you were able to learn and practice are 100% transferable to what you are hoping to do. And I think, right, understanding that connection for yourself and making, being able to share that in a way where you could say, yes, here's what I did for my AP experience in my master's program. Here's how that relates to what I'm going to do for you in an interview or whatever, networking, whatever that might be. Because those skills are incredible, right? The evaluation skills, the presentation, the collaboration, and also for you, the observation and understanding what folks might need that they don't have, seeing the gaps, right? That's really important. So yeah, I like that you focus on the skills. Caroline, what about you?
Today's internship confirmed that I enjoy working in directive communities and supporting programs that help improve health outcomes. My current job, I work with adults with disabilities. So, and my long-term goal is to become a case manager. I'm working with public health and disability services. So I believe that the communication, evaluation, and collab skills I developed in the internship will help me throughout my career.
Yeah, certainly. I think you talked in your presentation and even here today about that technical translation, right? Taking something and translating it in a way that it still retains its technical value, but is understandable by the folks that you'd be working with. And that's an important, like as a case manager, future public health practitioner, right? We have to be able to communicate with different audiences. And so that's a really important piece for you. So that's great to hear. What about you, Shannon? And you talked a little bit about the job hunt, but what's that looking like for you in terms of career goals?
So, I mean, I've been a birth doula for almost 15 years here in Tucson, and like this thing is always with me and it's always on. Would like to turn it off. I love being a doula, but what the master's program has given me is a broader perspective of other opportunities in maternal fetal health. Just taking what I already know and what I'm already passionate about, whether it's going to be advocacy or program planning. That was one of the great things about this is I got to write a program for gestational diabetes prevention for Indigenous people in Arizona, specifically targeted to Tucson. I got to write, I wrote a program, and now I'm doing the communication piece on preeclampsia and community health workers and calcium intervention to help lower the risk of blood pressure issues in pregnancy. so there's a lot of really fun that like that's a program that I think could launch with the help of WIC Nurse Family Partnership like tomorrow. Like it could happen. I'm just kind of looking forward to those, next longer term goals of just bigger picture and being able to turn my phone off. I will always be a little bit of a doula here and there, but I would like to take a little step back and use my skills for kind of more the greater good all at once, as opposed to one baby at a time. Sometimes two.
Yes. Yeah. I was going to say, I see subject matter expert in your future, right? On developing a lot of those things. You seem to have a wealth of experience you'd be able to bring to some of those items. I have two more questions. And again, please jump in if you have questions. But my next question is, what did you learn about yourself during this process? So not so much a skill or something you were able to practice, but did you learn anything about yourself as sort of a student or a professional that maybe you weren't aware of before your AP experience? I know that's a much more like meta type question, but I'm asking it anyway. Caroline.
Through the internship, I learned that I enjoy working. I enjoy work that combines community engagement, health education, and collaboration. I discovered that I'm adaptable and capable of learning new skills, but presented with unfamiliar projects or challenges. Professionally, I gain confidence and ability to analyze information, communicate complex public health findings into different audiences, and contribute to meaningful public health initiatives. This experience also clarified my career interests by reinforcing my desire to work in community health, disability services, and support individuals and communities through education, resources, and advocacy.
That's great. I love what you said at the beginning. You learned you were capable and adaptable, right? You've learned something about your ability to do that. And I think that's really powerful. It isn't just about the skill set. It certainly is for your instructors and your faculty and your preceptors, but there's also remembering what value you're learning about yourself. And so I think that that's really great. Thank you for sharing that. Shannon.
That's a good one. I didn't realize that I would enjoy public speaking. I guess talking to teenagers every day makes adults less scary. I had the opportunity to present at the Arizona Public Health Conference, and that was a really wonderful experience. So yeah, subject matter expert public speaking might be coming up next, but just we're much more capable than we think we are. And sometimes we just need the right people in play in our lives. And I think I've been truly, truly blessed both with my husband, who's my rock, and my amazing head of department, my preceptor, my co-teacher. Just really grateful for everybody that supported me along the way.
Yeah. Teenagers aren't the only ones who need to believe we're capable, right? We all could use a little bit of that in our lives, I think. Thank you, Shannon. Romina, what about you? What did you learn about yourself?
So this internship helped me a lot to identify both my weaknesses and strengths. I think I've become more open to receiving feedback and also giving feedback to everyone, particularly constructive feedback. And I've learned that I can work independently with a dynamic team, multidisciplinary team.
Yeah. Yeah, you talked about that in your presentation and you shared how that openness to feedback. And I think that's something that, it's easy to be defensive. It's easy to feel criticized. It's easy to feel frustrated. But when you can open yourself to that feedback, you can grow a lot. And so I think and I like how you just said it. You've gotten better at giving feedback too, and what that looks like on both sides of it, right? Because you'll have an opportunity to mentor and help other folks as well. So thank you all. I know that's a little more of a vulnerable question, but I do appreciate your honest answers. It's really important and we love to hear it. So I have one last question. Any questions from the audience before I ask our closing question? Okay. So what advice would you give to a student coming up, getting ready to do their APE, or a student entering the MPH program? What's that kind of parting advice that you would give to them about this experience? Caroline, can we start with you?
One piece of advice I would give to MPH students is to start looking for internship opportunities early and be open to experience that may be different from what they originally envisioned. Don't be afraid to reach out to organization, network faculties, and professionals, and apply even if they don't meet qualification that's listed. To ask questions during the internship, to ask questions, seek feedback when possible, because this experience will help on long-term goals, and to grow professionally and be flexible and willing to adapt. My internship taught me that every project, even those outside of my comfort zone, help develop valuable skills and clarity for my future career goals.
That's excellent. Thank you. That is great advice across the board, right? Put yourself out there to look for those experiences, help it sculpt your path, and then really be open to what that experience has to offer from start to finish. Thank you, Caroline. Romina, or I'm sorry, Shannon, you're unmuted.
Yeah. Just to dovetail off of what Caroline said, it's great if you can find something that you're already passionate about and is in your wheelhouse. But I think, yes, being open to other types of opportunities, maybe look more at the skill sets. What do I want to learn? Do I want to be stronger in biostatistics? Do I want to be, stronger in this area? So if it can't play perfectly to what you think you want, look for those opportunities that can grow on some things that, and don't be insecure about it. Just like, I know I need to grow here. This might be a really good opportunity. That'll probably help you win the interview too.
Yeah, that really looking at where your skills can grow. That's what the internship is great at doing, right? I don't think anybody expects students to come into an internship with the full skill set that an employee would. The point is learning, right? And so what is it that you're hoping to learn and engage with? And what do they have to offer and what do you have to offer? I think that's a really great perspective. Romina, what about you? What parting advice would you give to an MPH student?
So my advice is simple. If you're genuinely interested in a position, apply and don't limit yourself to obvious places. Always explore on different platforms, Handshake, LinkedIn, the hub, within your network, something that you'd be willing to put hours and hours at the same time enjoying that opportunity, not just doing that as part of your graduation requirement.
Yeah, that's great advice. It is a graduation requirement. We know that you have to do it, but you can enjoy it. You're allowed to have fun while you do it and learn things and grow. And it isn't just a checkbox. So I really appreciate that advice. I did not pay her to say the hub. We should have. We appreciate that. But thank you for also indicating that it's not just the hub. There's lots of other resources and opportunities out there, and ways that you can, as we found, right? You each found your experience differently. You had very diverse experiences, but they all tie back to collaboration, networking, skill development, figuring out who you are as a professional. So I thank you all so much for what you've shared today. I invite the audience to make sure they watch the presentations. And with that, I'm going to pass it on to Vanessa.
Thank you, Kim. We also want to encourage you to view the APE conference webpage to see this semester's MPH student presentations. They have all worked incredibly hard on their projects, and the virtual conference page showcases that. We will post this link in the chat here to the presentation viewing page. Presentations will be available in an on-demand format until August 14th. We encourage you to watch as many presentations as you can during the viewing period. For each presentation you watch, we ask that you fill out the presentation viewing page survey on that. So now I'm going to pass it on over to Danielle.
Thank you, Vanessa. And thanks everyone for attending today, and thanks to our presenters for this discussion. We would like to thank all our wonderful applied practice experience sites and preceptors with whom we work to improve public health. There's a link for a feedback form in the chat. We would appreciate if you could take a few minutes to complete that form to help us make this event better each time. Thank you, Kim. And we have now come to the end of our live event. We sincerely appreciate you all for joining us this afternoon, and thank you to our student panelists. And we hope you enjoy watching the student presentations and have a fantastic day.